Let's talk about delegation. This is very important to know because it's on the NCLEX exam. So the NCLEX can test delegation in two ways: assign and what? Best direction. Right. So how do you know if the NCLEX is testing you on assign or best direction? Let us look at sample question. Look at the stem right here. Assign. Look at the stem right here. Assign. You can see. Look at this stem right here again. Assign. Look at the stem right here. Assign. Look at this stem right here. Best direction. Now look at this stem right here. Best direction. Now, you can see now that the NCLEX can either test you on what? Assign, best direction. Now, the way you answer assignment is different from the way you answer best direction. Best direction is testing you based on statement, but assign is testing you based on the right task, and patient should be what? Stable. Right. So now when you are answering assign question, you are thinking about what? Task plus patient is stable. But when you are answering best direction, you are thinking about the condition plus the what, which is also known as the task, and the when, which is also known as timing. Right. So take note, when you see it assigned, apply this principle. When you see its best direction, apply this principle. Now, the most important thing about best direction is that every of those statements must have the condition and the what. Sometimes it might have the when, sometimes it might not have the when, but the most important thing is that it has the condition and it has the what. Now, the task should be specific and not vague. For example, let me just give you the commonly tested one. Now, if the NCLEX use ADL, which is activity of daily living, this is what? Vague. If the NCLEX use vital sign, this is specific. Because instead of saying ADL, NCLEX prefer you to say bathing, um, feeding, toileting, ambulating. Right. So maybe the patient want to do bathing, you say okay, assist the client with bathing. Instead of saying assist the client with their ADL, say assist the client with bathing. Or if it is one, or whether if the client want to do maybe two of them, you can say assist the client with bathing and feeding, assist the client with feeding and bathing, assist the client with feeding and ambulating or toileting. Right. So that's how the NCLEX exam works. So if you see ADL, just know that is vague. But if you see vital sign, that is what? Specific. So the only time we start thinking about the tax is when that particular statement contain every of these three things, or contain just these two things. That is when we start thinking about the tax to eliminate. Because one, if you have your option 1, option 2, option 3, option 4, and then your option 1 have the tax, the what, the when, I mean the condition, the what, the when, the condition, the what, the when, the condition, the what, the when. Now everything all have the condition, the what, the when. We don't know our answer, so now we need to start focusing on the tax to find out if the tax is specific and not vague. That way you are going to find out that three of the answer key will be vague, only one will be specific, and that will not be your correct answer. But yes, many of the times you might not even get to the point of thinking about maybe specific or vague. You might just find out that out of the answer keys you have, maybe this they don't have what? The condition, and only one have the condition, and then you say okay, that is your answer. Right. So yes, let's try as much as possible to, oh my god, let's try as much as possible to answer sample questions so that we can easily get the concept. Now when I answer my assignment question, this is how I approach assignment. Now what I always used to do is to look at the task first. So when I look at the task, I ask myself, is this patient this task, I look for the task in the answer key. So if I find out the task, maybe from the O4 option, the task. So I find out if this task the UAP can do it. Most especially NCLEX test you on what UAP, scope of practice. So I find out if the UAP can do that. Now when I do my elimination, sometimes I will just automatically get the answer even without not looking at the patient what condition. And sometimes maybe I will be left with maybe I will be able to eliminate two answers, and I'll be left with two tasks that UAP can do. So next, I'm now going to skip tasks and then move to what the patient condition to find out if they are what stable, because we deal with what stable patient for the UAP. Right. So just watch me do that right now. So now I can identify that this question is testing me on what assign. So I apply my principal tax and what stable. So I'm going to deal with the tax first. So I'm going to look for the tax. Assist the client to shower, check the ability to swallow, observe the client begin taking diet, transport to radiology department. So can the UAP assist the client to shower? Yes. Can they check the ability to swallow? This involve assessment, so no. Observe why the client begin taking diet. This involve assessment as well too, so no. Can they transport a client? Yes, they can definitely transport. So I'm left with what? 1 and 4. You can see. But the reason why this is smart is because you will not have to be thinking about this. You will not have to be thinking about this. You will not have to be thinking about um this as well too. Because if I just approach the question by looking at the tax and the patient condition, 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 I will be lost throughout the question. So let me do it step by step. Now, my first step has helped me to eliminate two answers even without not thinking about them or going through them at all. So now I'm not left with looking at only two conditions. Unlike before, I might have to look at what four conditions, but now all I just need to look at is just two conditions, because yes, my first step has dropped me down to two conditions. So now patient one, resp- respiratory distress, patient two, atrial fib. So easily you can know who is stable. Obviously this is not stable and then this is stable, so your answer to this question is what? One. This is smart, right? Now this is a sign as well too, right, based on your stem, right? And we are doing the assignment to the UAP. So I'm going to look at the task. This is apply continuous passive motion, change the bed lining, reposition, place in a prone position. Now this involve assessment, so the UAP cannot do that. Change bed lining, yes they can do this. Reposition, yes they can do this. Place in a prone position, obviously yes they can do that. Now we have three options right here. So now I'm not going to find out about if who is stable, right? Who is stable? Now the patient, this patient is just admitted 1 hour ago. Based on the fact that this patient is just admitted 1 hour ago, this patient is not stable. We should not be assigning anything to the UAP at this point, because this patient has not even spent 24 hours in on the unit, right? And obviously they have closed head injury and they are comatose just at the earlier point of admission. So this patient is definitely not stable. Now this patient, this is their condition and they are currently having headache and vomiting. This patient is not stable, so you are left with number 4. So obviously number 4 is stable. Now the principle of a patient is stable is that they have their condition, right? Maybe, but what are they experiencing now? Right. If the patient have what they are experiencing, then that patient might likely not be stable. But if they are not having anything they are experiencing for at least 24 hours, then that patient is stable. Right. This patient is newly admitted. Any patient that is just admitted are not stable. And guess what? They said the 1 hour, that is not even up to 24 hours. So the patient is not stable. But look at this patient above the knee amputation, and this 1 day ago, that is what? 24 hours. Right. So and they don't have any complaint. Unlike this patient, this is their condition and this is their complaint. Newly admitted and see what they presented with to the unit. And but this patient above the knee amputation, there's no complaint. So obviously number 4 is stable, and that's the patient you should assign to the UAP. Now this is also assigned, you can see right there, and then we are dealing with what? The UAP. So apply condom catheter, apply pressure dressing, obtain vital sign, insert NG tube. That is the task. Now, can they apply condom catheter? Obviously, yes. Apply pressure dressing? No. UAP don't do wound dressing, right? So out. Now, obtain what are they calling it? Vital sign. They can definitely do that. Insert ANG to this invasive procedure, they cannot do that. So we are left with 1 and what? 3. So I need to look at if the patient is what? Stable. Right. So now this is a patient who have hip fracture, incontinence, and guess what? This is what we are trying to do for the incontinence. And this patient is currently experiencing delirium. This patient is not stable. The fact that they are currently experiencing delirium out. So this patient incontinence condom catheter will fix that. So your answer to this question is 1. Right. So next is this, assign as well to the UAP, obtain vital sign, provide medication teaching, monitor for medication side effects, telephone primary health care provider. Can they obtain vital sign? UAP can do that. Provide medication teaching, obviously you know they cannot do that. Monitor for medication side effects, that's assessment, no. Telephone the healthcare provider, they cannot do that. The UAP and the LPN should report to the RN. Right. They should not telephone or report to the health care provider or primary health care provider. They should not, note that they only do to the RN. Right. So that's what you definitely want to know. All right. So next question, we have best direction. Okay, now this is not best direction. So since we are trying to explain best direction, let me make this space very clean. Right. So now best direction, remember we are thinking about the condition, the what, which is the tax, and we're thinking about what? The when, which is the timing. The when is the timing. Now, so I'm looking for condition if they have condition. So the client is weak on the right side, that is condition. Please check the client capillary blood glucose level and tell me the result by 7. I'm not seeing any condition here. We need to document vital sign for the client every 4 hours. No condition is here. Please encourage the client to change position frequently. No condition is here. All what I'm just seeing is tax, tax, and tax. There's no condition. So obviously I've X out this. I'm left with this. So this is the answer. You can see how it works. Now, next one right here. Let me rewrite the condition, the the what, which is the tax, the when, which is um which is the timing. All right. So now this is also best direction, you can see, and to the UAP. Now the condition, paraplegia, that's the condition. Mild Alzheimer's, that's the condition. Heart failure, that's the condition. Active pulmonary tuberculosis, that is the condition. So condition checked. So everything have condition, so we need to find out if everything have the tax. Right. So monthly safety check, that's the tax. Activity of daily living, that is the tax. Weight and vital sign, that is the tax. And right here, assist the client. When assisting the client, that is the tax. These don't even have a tax. You need to follow proper infection control. This is for the UAP. The tax should be for the client, not the UAP. Now they say we are assisting, so I don't know what we are assisting with, but we are coming there, right? So remember, we want the tax to be what? Specific and not vague. So everything look like we have the tax, but trust me, from looking at the tax right here, you can see this tax, this tax, and this tax. You can tell They are not specific and they are vague. Like now, this is saying we should assist. Let me clean. Now look at this one. This one is saying we should assist. What are we assisting the client with? What are we assisting the client with? We don't know what we're assisting. Are we baiting the client? Are we making them ambulate? Are we feeding them? What are we assisting the client with? So it's not specifying. So this is vague because it's leaving the whole task open to doing anything which we don't know. So that is vague. This is definitely out. Now, if you look at this one, it said we should weigh. That is very specific. And have vital sign check. That is specific. And not only that, he also said before breakfast. That is timing. Before breakfast. This one don't have any timing. This one don't have any timing. This still have timing. He said monthly safety. So this still have timing. But safety check right here. What are the safety check? Because there are a lot of safety check. Patient might be risk for fall, any kind of thing like that. What are the safety check? And not only safety check, safety check is not a thing for the UAP as well too. So this is also out. Now, activity of daily living, as I said previously before, activity of daily living is vague. It's not specific because with NCLEX don't want us to use it. NCLEX want us to say, okay, as assist the client. Okay, you can see this one now. He said we should assist. Look at this one. He said we should assist, and he told us to do activity of daily living. So this one even have the tax, but the only problem is that the tax is vague. Unlike this one, it's not even telling us what to assist. So this one is even totally wrong. This one is still partially right, but because of it is vague, NCLEX should be using something like baiting, dressing, feeding, ambulation, right? But see what the NCLEX is using. So this is out, right? You can see, and then our answer here is what? Theory, right? So now, to summarize, if you are to summarize everything we have been doing so far, so good. If you are trying to answer delegation question, remember that delegation tests you on two things, which is assign and what? Best direction. That's what NCLEX tests you on, right? I teach NCLEX standard, so yeah, this is what NCLEX tests you on. Now, the task is based. The assignment is based on what? The task and the patient should be stable, right? Best direction is based on the condition, right? The what, which is the task, and then the when, which is the timing. Now, based on my expert level, this is how I answer best direction. I'm going to go back to re-break something again, right? Because I'm trying as much as possible to not explain based on how I think, but based on how I feel like you should apply things, right? But let me see if we can as well catch up with what I'm saying now. This is how I answer best direction on the NCLEX exam. Now, I have the condition, I have the what, which is the task, and I have the when, which is the timing. Right. So one thing I always used to do is this. I know there are some of the statement that will not have the condition. So I'm looking for that statement that don't have the condition so that I can exit out. Now, if you look at this one right here, you will find out that every of the option and only this only have the condition. These don't have a condition, these don't have a condition, these don't have a condition. So I don't even need to start thinking about the what and the when. I've already got my answer right here. Right. Because your question can either have the condition, the what, right, and the when. So if NCLEX give you the question, is either the NCLEX is trying to make you look for the answer based on all others don't have the condition, or NCLEX is trying to make you look for the correct answer because it have the condition and have the what and the when. Now, when your question have the condition, it comes with the what and the when. Now, take a look at this particular one. We have the condition, we have the tax, we have the condition, we have the tax, we have the condition, we have the tax, we have the condition. Let us just say this is the tax. Let us just assume that is the tax. Now, I can see that we have the condition, we have the tax. Now I'm looking for the when. Right. Now, the when right here, I'm gonna say you should complete a monthly safety check. When are we doing it? You understand? When are we doing it? Is it monthly? Is it 29th of the month? Is it 30th? Nothing like that. So the timing is not clear right here. Now, this, if you look at this don't have a when. It's just telling us to assist. So this is out. Now, if you look at this, weigh and have vital sign checked before breakfast. You can see there's a timing before breakfast. So this is correct. Now look at this, no timing, out. You can see. So you can use that way as well to answer the question, but everything is all based on this. But most especially the task should be specific and not vague. Also, some people might say monthly is what? Some people might say monthly is timing, but guess what? Safety check is not specific. It is vague. This is vague because we don't know the kind of safety check we are doing. Right. And also, safety check is not the scope of practice of um the UAP. So you understand? So there are a lot of ways to figure out the answer, but they are all surrounding this. Right. So I hope you understand everything I've been saying in this particular video on delegation. If you can apply this, trust me, when you see question like this on the NCLEX exam, you instantly identify this is a sign, or you identify this is best direction. You apply this principle, you are going to get the answer correctly.